Good morning, good afternoon, good evening, depending on which part of the world you are in. I have great pleasure in welcoming each and every one of you to the seminar, rather webinar, being organized by Project Sanchar and Harvard T.H. Chan School of Public Health, India Research Center. Project Sanchar is a program that aims to build capacity for strategic communications among decision makers in India and in reporting on science journalism and health journalism among journalists in India. We have trained more than 200 journalists and 200 decision makers in India on strategic communications and health journalism. The Harvard T.H. Chan School of Public Health is an extended arm of the Harvard School of Public Health. The three foci of the center are facilitating research by Harvard School of Public Health's faculty in India. Second, capacity building and scholarly exchange of students and faculty from Harvard Chan and also Indian scholars to improve research and scholarship and teaching and practice of public health in India. And third, translation and communications, how to translate evidence base on urgent, emergent topics for public education, drawing on public health evidence. The third mission is the one that brings us here today, public communication and public education on an important topic. Some recent headlines in public and media discourse bring together a number of important social trends that raise significant public concerns. And these trends have to deal with adolescent mental health. And in fact, some have called it a crisis. Some even went to the extent of even calling it an epidemic. There is also a lot of attention to social media, both good and bad. And the growing penetration of social media is also drawing a lot of attention. And then the COVID-19 pandemic, and how it affected each and everyone on this panel, as well as the participants. So these seemingly disparate trends have coalesced together to lead to what some have termed a mental health crisis globally, not just in India. But it is a critical topic anywhere in any part of the world. For example, if you take India, India has one of the largest population groups of young people between 10 to 19 years old, almost comprising 1/5 of the population, more than 250 million. At the same time, India also has one of the highest penetration in terms of internet users, close to 700 million people, more than the population of most countries. There's more than 1 billion cell phone subscribers, almost close to 500 million social media users. So you can see why these two trends of young people, growing population, big population of young people, and social media are attracting a lot of attention and the connection between them. It's just not the ubiquity. It is a public discourse that is critical and important. There is a lot of attention to social media. Some have argued that they facilitate connection and interaction among adolescents and teenagers, young people, with parents, friends. Particularly during the lockdown, they have been able to decrease social isolation and allow them to have connections and feel that sense of cohesion and connection with the rest of them. At the same time, social media have also been blamed for negative outcomes, such as cyberbullying, the stress, the so-called FOMO, feeling left out, fear of missing out, the challenges of presenting only the positive aspects, and of course the algorithms feeding negative news and negative views on social media. So it's this tension between the positive functions of social media as well as the negative functions that bring us here today, and the impact they have on public health is what is affecting us and what we want to talk about. So that's why we are here. My name is Vish Viswanath. I am Lee Kumke Professor of Health Communication at Harvard T.H. Chan School of Public Health. I'm also the Faculty Director of the Harvard Chan India Research Center and Director of the Lee Kumshun Center for Health and Happiness at Harvard. And I will be moderating this panel to really answer our questions. We have a very highly distinguished group of people. I will introduce them shortly in a second here. For the participants, I just want to direct you. So what we will start off is with a few questions to the panelists, drawing on their expertise. And we will have this conversation with them for about first 20, 30 minutes or so, after which we will open it up for questions. If you have questions, please put them in the Q&A box, the question and answer box at the bottom of the panel on your screen. My team members will be monitoring them, and they will feed me the questions. And I will, in turn, ask the panelists. So thank you for joining us. So let me introduce the panel. As I said, a very highly distinguished group of people. We have with us Dr. Anjali Chhabria. She is a psychiatrist and director of Mindtemple Institute of Behavioral Sciences. Dr. Chhabria is a psychiatrist and a psychotherapist. She's long recognized for her outstanding contributions to mental health. She finished her medicine from MBBS from JJ Group of Hospitals in 1985 and an MD from Nair Charitable Hospital. She's a regular columnist. She continues to be a household name through her contribution to newspapers, magazines, and interviews on television and radio. In fact, she authored a book, Death is Not the Answer, which breaks the taboo on the sensitive subject of suicides and provides the readers ways to prevent it. She's being joined by Dr. Kanika Malik. She's a faculty member of psychology and counseling at OP Jindal Global University. Dr. Malik has worked in the field of psychology for over a decade, and she has had many roles, including as a clinical psychologist, clinical supervisor, mental health researcher, and a teacher. Most of her work has been in low-resource settings, and she has been a recipient of multiple grants from both national and international organizations. Thank you for joining us. We have next Ms. Tshering Bhutia. She's a vice president for Preventive Health and Nutrition at Salaam Bombay Foundation. It is an NGO dedicated to adolescent well-being. She has a track record of designing and executing impactful social developmental projects. She has a strong commitment for sustainability and community engagement. Her current efforts are concentrated on developing and implementing preventive health education initiatives, including on mental well-being. Thank you for joining us, Tshering. And last, but certainly definitely not least, we have Dr. Zoya Ali Rizvi. She's a Deputy Commissioner, Adolescent Health, Ministry of Health and Family Welfare. We couldn't think of a better person to talk to us today. She has a vast experience of working in the government health sector at different levels, district, state, and national levels for more than 2 decades. She's an alumna and gold medalist from King George's Medical College, Lucknow, and the London School of Hygiene and Tropical Medicine. She has been involved in a number of policy programs. We will ask her about it today, including the National Adolescent Health Program, and certainly involved in flagship school and health and wellness programs. So thank you, Dr. Rizvi, for joining us. So let me say, thank each and every panelist for joining us, for your eagerness and rather your agreement to share your thoughts with us. So what I would like to do is maybe open it up for some opening remarks with each of you. Maybe if you can take a couple of minutes each, 2 to 3 minutes each, and say what you think are the critical issues from your perspective, and then I will have questions for you. So maybe I'm looking at my screen here. For the opening remarks, maybe we'll start with you, Dr. Chhabria.
Sure. Yeah. Thank you so much, Dr. Viswanath. Thank you, Howard Chan, for this wonderful opportunity and getting people together to discuss. I think it's one of the most important topics today. Adolescence, I mean, what can be more important than the mental health of adolescents? And we all agree that today social media is something that adolescents cannot do without. I don't think we also can do without it, but the impact that social media has on each and every individual. And when we are talking about India, India is a huge country, and the adolescents are really different. Even in a city like Mumbai, where I belong, you have the ultra rich who may be using and abusing social media in one way, to the slum kids who have been, again, using and abusing social media in another way. Now, I work primarily with individuals, and I think on every day of my life, I would maybe eat, breathe, at least 4 to 5 young kids who come to me, and of course, parents who come. And some of the things that you hear every day is, and what we've seen as a change in our country, in the last maybe 15 years, where everyone has a phone in their hand. So when you have young parents, what age do I give my child a mobile phone? Children and sometimes even parents are lying about the age so that they have access to the phone, and how they use it or misuse it. What extent can they go to? There is violence, there's aggression, there are also suicidal threats which are made because I want to be to be hanging around with my friends on social media. On the other side, of course, what we see on social media is nobody puts up a bad hair day on social media. So, but what happens to the other people who are watching them? I want to be like this one. I want to be like that one. Why is my life not so great? And you see what social media, the impact that it's having on the mental health of kids who are struggling with anxiety, struggling with depression. What happens to them? Of course, cyberbullying is something which is there. One comment, one bad comment, and so many people join in. And what happens to such kids? We've also seen, young adults, adolescents who have gone to the extent of announcing that they are going to kill themselves on social media. And of course, a lot of the media that they use have kind of come up to that, but we still do not have the way to kind of hold them back. How do we come together? Now, I think we need to use social media, and I'm really excited about what you all are doing. So I would like to know what the other panelists are now thinking about or sharing.
Yeah, thank you so much. I think those are really provocative and a great set of opening remarks from a clinical perspective and what you're saying. What I want to do now is get a population perspective. So Ms. Bhutia, go ahead. So.
Yeah, thank you, Dr. Vish. Thank you for the introduction. And I think Dr. Anjali Chhabria had a great opening, actually, the points that she made. The adolescent mental health, definitely. And then, as she was saying, she's working in Bombay, where we can see the ultra rich kids, at the same time, those who are underprivileged. And Salaam Bombay Foundation has been working with underprivileged children since long. So, the kind of experience that we have had, and in fact, this is something that first of all, I would appreciate Harvard Research Center India for calling this particular webinar, because it is very, very important. And this is something that we need to discuss. Number one point is, this is what we have observed. So I'm going to share the insights that we have had. Point number one is mental health or mental well-being, which was not so spoken about pre-COVID. Pre-COVID, it was not so spoken about. It was there, but not so spoken about. In fact, after COVID, it is being recognized or acknowledged that, okay, fine, we need to talk about mental health. And this is something that we need to keep on doing, because this discussion is very, very important. That is second point. The third point is, we have during the COVID also, and generally also, we talk about a lot of mental health issues, about mental health well-being, especially for adolescents. But in most of the platforms, what we have observed is that is being spoken in general for the general population. But when we talk about underprivileged children, the issue or the matter is, it's almost same with the general population, but the intensity of the struggles that they are having is much more greater than the general population. So I think as we go ahead, I would definitely like to hear from other panelists also. And as we go ahead, I will give my insights and the inputs that we have experienced during COVID-19, during lockdown period, with especially adolescents who come from the underprivileged background. At the same time, we have done various research also. And through that research, the findings that says that there is a prevalence of mental health issues among those kids, that is also what I'm going to share. Thank you so much, Dr. Vish.
Thank you so much. I really appreciate that. Let's go to Dr. Malik for just 2-minute opening remarks.
Thank you.
You are on mute.
Yeah. Yep. Hi. Thank you, Howard Sajati, for inviting me to this webinar. So I will be sharing my views from the experience in 3 different angles as a faculty who teaches highly privileged kids in a private university in India, and a clinical psychologist and a mental health researcher who works really in low resource settings like public, government schools and public universities. I think Professor Viswanath has already talked about, he has the largest youth population, and the boom of social media is not surprising in this context. But what stood out for me in the last couple of years is how social media has really done well for improving the accessibility of mental health, understanding about mental health. I know before the social media boom, mental health was something hidden under the carpet for the bad people on the road. Social media made it happen that people do, young people are adolescents, do want to talk about mental health. It's a term they know. They know there's something called depression, they know something called anxiety, they know something called panic. Those terms, people have come to know, have learned to talk about sensibly. Counseling is something now everyone knows. Even when I was working in government school, everyone knew what a counselor is and what counseling did. So I really appreciate, what social media has done to improve literacy about mental health and accessibility of service to some extent, and also building community. I can share this story. I know 7, 8 years back, I was a part of panel in a university where, a group of mental health professionals was talking about pitfall of social media for mental health. And everyone saying this bad, that adverse effect. One student, very subtly interjected and said, I agree with what you're saying, but, I have been struggling for a while. It took me a year or so to realize I have a mental health issue. I went to university, counseling cell, and they put me on wait list for 1 year. It took me 1 year to get it, say I need help. They put me on wait list for 1 year. And thanks to social media, I was able to connect with people who are like-minded, who have got a similar experience. They helped me realize what I was struggling to. Their experiences, helped me understand what I can go to. And I also got in touch with some counselors who can help me. And this experience, the testimony has always shared with me. So no matter what, we understand there are reverse effects of it, but it has done a lot in terms of growing literacy, accessibility, creating community space, and even spaces for academic growth. I can personally vouch myself. I follow more job openings and grant calls on Twitter than any other traditional media. Somehow Twitter has all grant openings coming up. You never find it on any other platform, no matter how much you're paid for it. Um, so that's the plus side of it. I think I'm with my other panelists who say that it also comes with its negative.
Mhm.
There is a lot of clinical work all of us see that how this entire race of followers and popularity is having a negative impact. A lot of adolescents who are going through this phase of self-love and identity formation. So a lot of editors believe, how to be successful, how life works, how body image works, how you can reach on top, and that put them at risk of failure and also risk for many mental health disorders. And our clinical research supports that. It has found the people who use a lot more social media, say 3 hours or more, have a greater prevalence of anxiety and depression pre-COVID, during COVID, and post-COVID. So that's something has been prevalent, over the years, and research has tested time and again. So, like any potent tool, it has its pros and its cons. I think it's the user who decide, what direction they will end up doing it. And hopefully we'll discuss in today's webinar, what can help in the healthy and unhealthy use of social media.
Great. You have put some really critical issues on the table, and I think we should come back and talk about them. I think I really particularly like the tension between issues that Ms. Bhutia and Dr. Chhabria are finding in their respective practice worlds, and but what we know also on the other side. So, Dr. Rizvi.
Okay. Thanks, Dr. Viswanath. I think my view is very different from what is being discussed. I am looking at it from the perspective of a holistic health of what we are working on for adolescents in the country. I think we fully realize that as a country, we're not getting any younger. If we are looking at the population projections, we are only getting older by the year. So if our average, say, is 26 now, in the next 5-6 years, it will be pushing 28, 29. So whatever investment we have to do in the health of a young person has to happen like yesterday. So with that belief, I would say mental health is one of very important component of the National Adolescent Health Program, but we also...
Dr. Rizvi, you are on mute. You're gone on mute for some reason. So,
oh, okay. Yeah. My hand was here. Okay. Did you get my population projection one part, or should I just go ahead? Okay. So I was just saying mental health is just one part, and what we have to work within the government and within the adolescent health section is that all kind of health is interrelated. So whether it is the sexual reproductive health, whether it is substance abuse, whether it is nutrition, whether it is prevention of NCDs, prevention of violence, all of it is so entwined with mental health that if we start addressing one in silos, it becomes really difficult. So whatever program planning we do at the national level, supporting the states and the UTs, it has to be holistic. And with that in mind, whatever I would say, curriculum, training, whether it is for the healthcare providers or for the teachers or parents, has to be more holistic. So I will speak from a more holistic point of view than just targeting mobile use, because we do realize that there is a huge rural-urban divide within our own young people in India, as well as a gender divide. So that is something which we have to keep in mind a lot of times when we are planning for any program implementation. So I would rest here and see how the conversation goes.
Great. Thank you so much. A number of issues have come up, and so the heterogeneity of the audience, it's not the most sexy phrase, but it does capture, we have urban, rural, socioeconomic status or social class, rich, poor, people who live well, people in slums, or people, in different parts of the country, and then cultures, languages. So it's a very and each of you has certainly talked about that kind of a heterogeneity in population groups, subgroups, and how do we generalize, to all of them. And you also talked about how, I think, parents are in a tough position to make some decisions. They are not going to go out and read a journal article they are coming to Dr. Chhabria and saying, what do we do? Give us some practical advice that we can implement now. And of course, mental health is a taboo, remains a taboo, but people are coming out and talking about it much more openly than they did in the past, and social media have enabled that. And then in some cases, it is precipitant to a crisis like violence or aggression. In some cases, it's enabling people to articulate their frustrations. So these points are really well taken. So I want to go into the specifics now with each of these. So Ms. Bhutia, let me start with you. So you have been on the ground working with these adolescents, these teenagers, day in and day out, promoting the holistic, really what Dr. Rizvi was talking about, right? You are focusing on physical health, but you are also, you have been working on mental health, and you use the term mental well-being. So not the illness, but also the well-being part. What are you seeing at the ground level? So specifically among adolescents, and to what extent, especially from a social media context, day in and day out, is there more attention to mental health issues? Are you seeing more mental health challenges among adolescents as you're doing this work?
Yes. So let me begin from mental well-being. So when we are, as you correctly said, that when we are working with these children in the school, we do not use the terminology called mental illness. Because when we go to that particular community, mental illness still is taken as a stigma and discrimination. As soon as we use this terminology in India, it is considered that you are crazy, correct? So that is not the terminology that we can use if we really want to feel welcome by the community, by the schools, and by the students who would hear. That is one. Second, mental well-being itself is a very tough subject, correct? It's a heavy subject. Sometimes when you go and then talk to the adolescents who are maybe between 12 to 19 or 18-year-old. So you have to, our entire module is made in such a way where it can be a child-friendly, adolescent-friendly, where we can teach them, or at least we can introduce them to what mental well-being is all about. For example, in our program, we don't call it, though the program is focused on mental well-being, but we don't call it mental well-being. We call it Happy Minds program, because then that itself sets a very positive attitude towards it, correct? So we don't call it mental well-being or mental health. We call it Happy Mind program. And there are issues, of course, we have seen. And especially the children that I am talking about, the underprivileged children, definitely their problems, the mental health issues are not different from those who come from an upper or a privileged section of the society. It's not different. But as I said earlier, the intensity of their problem is very different and is much more higher than what a privileged child will have. So to give you an example, for example, a child from a privileged, and now when I'm talking about social media, the exposure of the social media has, as we have been talking and the panelists have been saying this, that there is a positive as well as negative impact of social media on mental health, correct? And that is something that we have also been seeing. There is a positive as well as negative impact. But in our case, there are certain exposure which definitely has helped them, which of course, moving ahead, I will share. But there are negative impacts also, and the struggle of the underprivileged children is much more higher. So for example, now there is so much of exposure. Let me give you one example which makes the picture more clear. For example, let's take the educational pressure that our children have, correct, or adolescents have. So in every family, there's a pressure on child that you have to perform good. And because of the social media exposure, earlier it was, when there was not much of a social media exposure, there was exposure, but there was less exposure. So for example, if you were compared to only Mr. Sharma's beta, Mr. Verma's beta son, correct? Mr. Sharma beta has scored 90%, so you have to score 90%. Now there's more exposure. Parents are exposed, students are exposed. So competition is not only till Mr. Verma or Mr. Sharma, correct? Now it has gone worldwide. So now your expectations of performing has also gone higher. And that's the reason why the pressure has increased, correct? But when we come down to the underprivileged child, so right now I was talking about privileged child, where definitely he is going through certain kind of pressure with regard to his educational qualification, his education or schooling. But when I come to underprivileged child, he is or she is also going through that kind of mental health issues or that kind of pressure. But the pressure is different. Here, pressure is not that he or she is not competing for any global school or for 90% score or 99% of score, correct? Here, she is struggling. Tomorrow, will my parent be able to pay my fees? Will tomorrow I will be able to be in school? My teacher asked for some project, material. Will I be able to buy it? And here, gender disparity also comes, correct? Disparity of gender also sadly comes in, because in a family, if there are two brothers and one sister is always under pressure, because the priority of sending school will be given to those two boys in comparison to her. So these are various kind of issues which is there. And as I said, social media has added to it in a positive as well as negative way, as we all have been talking, that during because use of the social media has allowed them to create that kind of network, correct? So they are definitely interacting with other people or joining certain community, which is of course encouraging them to do something good. But at the same time, there are also communities, or there are certain things which of course is increasing their anxiety and bringing them to the depression. So
excellent. Yeah. So let me get to that specific point of depression and anxiety, particularly from a comparative perspective, right? I mean, I think our paper will be coming out. If not, it has come out. We are maybe it's doing some meta-analysis and finding that social comparison is a huge issue. I think, when if there is an area where social media are having a negative impact, it's in that comparison, right? That you so eloquently put together. So from a population perspective, I think, and social media are amplifying that, as you rightly said. Dr. Chhabria, what are you seeing in the clinics, right? So you have these on-the-ground reality that Ms. Bhutia is experiencing, right? So kids comparing with each other and parents comparing with the kids. But you see families together, and you have these tensions of tremendous pressure and on performing or outperforming everyone else, right? So and then with these clinical outcomes, what are you seeing in the clinic, and how do you attribute that to social media?
So first of all, what we are actually seeing is that everybody is glued to their phone, whether it is the parent or it's the child. So people sit on a dining table, and until and unless there are rules made that people are going to keep their gadgets aside, people are not even looking at each other. There's no eye-to-eye contact, and that itself is creating certain issues. And what happens is, when parents come and complain that their children are not interacting with each other, or with us, okay, then the other thing we are seeing is a lot of sleep issues, because there is, until and unless there is discipline that the phone is kept away, everybody wants to go on to the gadget and use it till the wee hours of the morning. As a result of it, teenagers are not getting enough sleep, they're not being able to get up, and a lot of, because of that, we are seeing aggression, okay, coming out, and aggression in the house, whether it's parents hitting their kids, kids hitting their parents. Okay, so these are some of the things. Of course, depression and anxiety is also something which is rampant. And yes, they may communicate with other people, other important people. They may be able to get help on the net, but they may also get drawn into areas which are not so great. I mean, today they may join certain groups which will help them to procure substances which could help end their life. So there are a lot of issues, of course, even substance abuse. Then even people just looking at, so when we are talking about the underprivileged, the problem is that the youngsters today aspire, and we are seeing a lot of Indian kids want to aspire. Everybody wants to become a Shah Rukh Khan, if you know who he is. So people feel that, yes, I can do that. And the more you see, so we see a lot of TikTok users where people are creating reels, and 6 and 7 year olds want to reach out to the world by creating reels. So there's tremendous pressure which is probably self-inflicted, and of course, using social media to distract oneself, to get into another world and to get away from the real world is also affecting their education.
I see. Now, before I go to Dr. Malik, I just want to remind the audience, please put your questions in the Q&A box. My team is following it. Given the number of questions and comments coming up, we'll get to them sooner than later. As you're doing that, so Dr. Malik, so here we have two tensions. So we have a population health perspective where Ms. Bhutia is working with a large number of people and seeing these kind of aspirational challenges. Particularly, the aspirations do vary depending on your socioeconomic status. But nonetheless, there are these aspirations, which by themselves I don't think are bad, right? I mean, those are, but unfulfilled, our ability or capability of inability to fulfill them may lead to some problems. On the other hand, we know that fairly good evidence that social media, and in fact, Dr. Chhabria has talked about it, and even Ms. Bhutia, people are able to actually talk about these things openly, which they could not at one time, and seek help elsewhere. What does research tell us? What does, we talk about evidence-based practice. What is research telling us about this?
So thank you, Professor Viswanath. I think research will tell us something, as we have heard in the opening, the picture is quite mixed. So at one end, we have research telling us, social media has its benefit, as we talked about, it giving a platform to build community connections, to connect with others, overcome loneliness. I have seen, a lot of this social media actually is now being used to recruit adolescents to be part of research projects and get their voices as the authors of researchers, as the co-investigators. So it has, a lot of it has also been how it has helped, adolescents empowered and get involved with initiative, not only in their state, country, but across globally. So we have seen those undertones, themes related about the positive aspect. And also on the other hand, we have all seen the negative aspect, specifically, how overuse of social media, spending too much time on social media, the type of content that is being used on social media, like unchecked, unregulated, and third type of, going through, are you an active user versus you're just a passive user, just browsing and looking just at videos and content. It's like a stalking sort of thing on social media going on. So all of these, have been connected with different kind of mental health issues. For example, one of the big research and systematic review found that, use of social media for 3 hours or more in a day has put individuals at high risk for depression, anxiety, and they also talk about how that's why depression, anxiety has increased a lot during COVID-19 because many more adolescents were on social media, on web, internet, forcibly, unforcibly, exposed to the social media component about it. The research has shown, girls are much more prone to negative effect of social media as compared to boys. They get exposed to the vulnerable content. We have also seen, somehow the research paper talking about how the way Facebook and other social media platforms are designed. They are designed to be addictive. They want adolescents to spend time. They push notifications, they send messages. The design is that you want to keep scrolling until unless it says end of feeds. So all of those things, have talked about, whether it's those related, the gender thing, the type of, navigation you're doing, the type of social media you are, push notification you get, or the trend games. I'm sure all of you remember that Blue Whale episode where, there was a high rise of suicide among adolescents and young people. Somehow it got a badge of honor, you play it. If you don't follow it, that's what the repercussion, you end up doing it. So, so again, research again talks, the evidence has talked about it. It's a mixed kind of it. And I think my takeaway is that, it depends on how you use social media. If you know you are digitally literate, you understand what is the content, how the content is being used, you're able to balance its use. it can do wonders for you. If you go into that addictive spectrum, it can really put you at risk for mental health problems, including something like increase in suicidal behavior and suicidal tendencies.
Okay, so so there is some evidence on both sides of the coin. So I'll go to Dr. Rizvi next. While I'm getting my question ready, I think my team will, maybe Ramya, Anupa, you can start sending me questions from the audience. I'm happy to pose them while my team is doing that. Dr. Rizvi, you have a challenge here. A policy is a blunt instrument. As a policymaker and a policy implementer, you cannot. So if you heard the three panelists earlier, each of them have highlighted the complexity based on the audience, right? So you have underprivileged as a word is being used. You have wealth as a criterion, as social class. You have geography. You have people who are actually have clinical illnesses. But you also have just regular stress. Stress is a part of life. Stress is not necessarily bad. It's a question of how you cope with it is important. So there is that spectrum now. How can you, from a policy implementer perspective, policy maker perspective, and as somebody who is not only focusing on mental health, but also focus on what you called holistic adolescent health, what are your challenges and how are you dealing with this?
Oh, that's a very vast question.
Yes.
I would say that since we see child or an adolescent as a part of an ecosystem which involves where the child lives, where the child studies, where the child plays, where the time is spent. So we try and access or provide services wherever the adolescent is, whether it is in school, whether it is in the community, or whether it is in the health institution, if they actually access the institution, right? So with that in mind is what the government, whenever we plan any programs or we implement or we design, that is what we have done with the National Adolescent Health Program. We have a component which is facility-based for those young people who are able to access the health facilities. We have the clinics, adolescent-friendly clinics. For those who are not able to access outside, we have what we call the peer educator program, in which young people are selected and trained on the 6 thematic areas of adolescent health, including mental health, that is there. And for those who are going to school, we now have the school health and wellness program, in which we are training teachers to provide, I think, information on especially mental health is one of in fact, out of the 11 themes of the school health and wellness program, 6 of them are directly health related. So that is the importance health has been given by the Ministry of Education also. And just a small data I would like to share here is that a survey, which many of you must be knowing, was done by NCRT during the lockdown with the young children. About 3.5 lakh children participated in that. And that really showed that the major cause of anxiety and stress in school was academics only. So it actually boiled down to 81% of them saying that they're really stressed out due to academics. And the next in line was the appearance, self-appearance and the body image concept, and the hesitation in asking questions, being looked down upon in schools, the peer pressure of performing well in socially as well as academically. So there are a lot of issues which came in through that. So I would say any interventions, whether it is through school, through facilities, and through communities, has to also involve the parents. That is where I think as a policy, we are, I will not say struggling, but we are looking at developing a lot of materials in which parents become a part of development and program implementation of anything, whether in schools or communities. And what we as I think government believe is that once parents are onboarded, because mental health is one thing, there's a huge denial in parents as well. They don't accept it. Nothing wrong. He's too lazy, he doesn't want to do anything, just keeps or whatever, etc., etc. So first is to acknowledge that mental health is an issue. Second is, okay, if you have an issue, where do you go for help? So building those linkages is something which is a big challenge for us as a country, because we do not have adequate number of healthcare providers. And to say, a lot of healthcare providers we have are not sensitive enough. So it is a dual challenge. You have to get in, I think, onboard more mental health providers as well as train the ones you have. and in fact train them, especially with adolescent. You are fully aware, you have to train them to be non-judgmental, empathetic, so that the young person who's accessing services keeps coming back to you. And that is where governments, I think, struggles, because a lot of people who come once do not end up coming, because the person you train gets transferred, so we have a lot of challenges which we are facing. But I think the sheer fact that we have acknowledged that it's an issue with young people, and there are a lot of NGOs which I'm seeing, Ms. Bhutia is here. We work a lot with NGOs who are in the field, because we do realize the government can only do so much. The last mile is often covered by the NGOs, by the private practitioners who are out there, because we don't reach till the last mile. So I think it's more of a collective action which we have to do, so that whatever little we are doing, it is supported by the private practitioners, is supported by the CSOs, and of course by the parents.
Wonderful. So you raised some interesting issues. One of them, which I thought, the idea of health access to mental health services is absolutely critical, and I appreciate it. I think this is a continuing challenge, particularly at a time when we have globally, I think we have shortage of mental health experts. Dr. Chhabria, you can relate to this. We don't train enough people, not just in India, everywhere. I think this is a huge issue. So I'm glad you raised that. There are a couple of things that are coming up, both in the questions and in the conversations here. So I want to go to Dr. Chhabria first and see how Ms. Bhutia and others are also handling this. So what are the, parents are coming to you, Dr. Chhabria, right? Asking for suggestions. When do I think you mentioned it earlier. When do I give a smartphone to a kid? There is pressure. When do I let them be on social media? Or what do I do to wean them away from social media? What are the 2 or 3 practical tips based on your expertise you can give?
Vish, before I answer that, I just want to add a very, very important, something that all of us should know is that 40% of mental health disorders start before the age of 14.
Yes.
So we need to keep that in mind. So whether, we have to create the resources, we have to use the resources, and luckily we can connect all over the world. So the world is open to us, so we must together have nothing to fall short of providing the adolescents the health tools that they need to have better health. And recognition of a problem is awareness. Creating awareness is the first thing that we do. Now, coming to your question about how do we use the gadget effectively, I think the first thing is we start with how does a parent use it, because children learn what they see, not what they hear. So if we have rules in the house itself that after a particular time, whether it is 8 o'clock, 9 o'clock, whatever it is, just as we have our bedroom to go to sleep, the mobile phones, the gadgets have to be kept in a certain area, and of course, children are children, adolescents are adolescents, they will try and sneak in, they will want to. Now, how do we deal with that? Do we punish them? Do we use aggression? Or do we understand that they're kids and they will want to do this? So understanding a child, listening to them, inculcating a fair sense of discipline and getting them involved, making them partners. So if we discuss with them that, okay, yes, you want a phone, you have a gadget, how are we going to use it? How are we going to, kind of ration the use? Okay. And of course, providing them with other options. I often tell parents who say, my kid is addicted to the phone. I said, you know what? Just start playing a game in the house. Every evening after dinner, either go down for a walk where all of you go and you all sound happy, or just start playing a board game in the house, the rest of the adults. And believe me, by the 3rd or 4th day, the child will want to come. The problem is that the stress in families has increased so much that everybody is looking so anxious and everybody is looking so involved in their own head that people want to seek their space, which is to them a happy space. So if we provide spaces of happiness, I was reading about Salaam, Bombay, the fantastic work that they've done, especially during COVID. What they did was they involved kids from slums. And these kids were having fun. Now, these were the kids who had actually reversed their sleep timings. They were sleeping in the day and being awake at night because of the environment where they lived. They live in slums. They have, their parents are there. Some of them are alcoholics. So children want to go away. And these people have done such brilliant work to make them play, to make them interact, giving them tasks. So the same thing actually we need to involve in all houses. We need to create alternate systems of having fun. Families need to play together. Once you start doing that, the child has options,
Yeah, it's interesting. And I'll come to you in a second, Dr. Malik. I want to get the population perspective too, and then I'll come to you. But Dr. Chhabria, I think this is an important issue, and questions are also coming up on this, right? What you are suggesting, excuse me. So, number one, parental mediation, right? Not scolding, not punishing, not the penal approach, but that's a persuasion, participatory approach with a child, with the adolescent. The tensions between parents and adolescents are already fraught in many ways, given the cognitive development. But what you're saying is that partnership is essential, making time to work with them and through them to address whatever smartphone addiction, usage, etc., whether it is online games or social media use, and being a part of the child's teenager's life. That's really an important point. I think that's what we have learned, at least from other media exposure issues. So, Tshering, what do you do? So when parents come to Dr. Chhabria's clinic, she's able to advise them on this kind of a participatory approach. What do you do when you're dealing with thousands of kids or teenagers, as you are doing?
That's a very interesting question, Dr. Vish, because the parents who go and then visit Dr. Anjali Chhabria are very different parents, correct?
No. I have people from the slums coming to meet me also,
yes,
and believe me, their problems are the same. Sorry, Tshering.
Thank you. That's great to know that. But in our case, Dr. Vish, it has been a very different, correct? Because when we did research and when we did our focus group discussions, our parents are not aware about mental health issues only. That's a new terminology for them. They don't know it, correct? So in our case, what Salaam Bombay Foundation has been doing is, for us, our focuses and our, the center is always adolescents. So everything that we have done is for the adolescent, around the adolescents and via adolescents. So as far as mental health is also concerned, as Dr. Zoya was also saying, a comprehensive and a holistic program is very, very important. And that is what Salaam Bombay Foundation has been trying to do. So our program is not only mental health, correct? We have been working with children on honing their life skills, correct? We have also been working towards creating awareness among teachers and parents, as well as we are working on their nutritional levels. We are also working on their substance abuse, correct? Especially on tobacco, how they are consuming. So these are all factors which is very, very important if we really talk about mental health of an adolescent. So let me give you more clarity on that one. So for us, what happens is, parents are not aware. Adolescent are, as I say, adolescent is an age when, it's a developing age, correct? So what happens is, the brain regions associated with the desire for attention seeking, feedback or reinforcement from peers, that becomes very sensitive when you are in a developing age, correct? But at the same time, your brain regions which are involved in self-control is not so mature at that point of time. And therefore, our life skill programs is really helpful. We try to hone life skills of these children, whether it is about self-esteem, whether it is about decision-making or handling peer pressure, resilience. These are the topics we deal with. And this is to some extent helping us to, to help those children or guide that how they can control themselves when it comes to the social media uses for them. This is something. And through these children only, we are reaching out to their parents to create awareness among them that what the mental health is all about, what is mental wellness all about. So this is one of the steps that we are using, Dr. Vish.
Great. So before I go to Dr. Rizvi, we are running out of time. But Dr. Malik, what can you bring this all together? So I mean, some of the critical points here that have been made are about partnerships and looking at it from a more integrated perspective, whether it's parents and teachers and capacity building among them. You know, so where are you? What do you think? So.
I think what Dr. Chhabria and Tshering talked about, it really made sense. You know, we have to get all of them together, giving adolescents the voice and the empowerment to act on it, and getting parents, you know, to have a discussion, have a co-participatory approach. I think somewhere also what I need to, you know, parents need to understand adolescents are not adults. So I've seen a lot of time, you know, they have expectation. We can sit without doing anything for half an hour, 1 hour. Why can't my adolescents sit? No, they can't, right? They are in this developmental stage where their body, their mind, not choose to do that. And if they can't do anything, mobiles and the social media are the easiest access to, you know, keep them engaged and provide the stimulation they are looking for. So I think one, as I said, you know, it's a partnership. If we have to talk about healthy use, we have to get both adolescent parents, teachers on the board. I also, you know, read about many research talking about that digital literacy now should be part of life skills training, right? Young people really need to understand what is social media, what is safe browsing, what is unsafe browsing, what is private data, what is being shared. In the case you're being cyberbullied, your information is misused, how you can ask for help, because I'm sure Dr. Chhabria can talk about it. Many adolescents will not even know whether they're being cyberbullied or, you know, being shamed on social media, whom they can go for, you know, help. All they end up is hiding or, you know, deleting their account and suffering in misery. So, you know, among other techniques which, you know, have been also helpful for other addictive behaviors, which have also been suggested for social media addiction, I think these two aspects, digital literacy and, you know, making it as a collaborative effort. I can think, you know, I'm reminded one study where they found parents who had a heavy mobile phone usage actually had the worst parent-child interaction, in turn, heavy usage even among adolescents. So adolescents, what they see, what they happen actually influence, you know, the next generation that we are bringing up in our country, globally across the world. So that I will say, you know, again, healthy usage, mediated, coming together, more digital literacy programs in schools, outside schools, and understanding that, you know, this is an age group will need suitable venues. I don't know how many of you have good parks, good community clubs around you. I don't have any, you know. My daughter is 6 months old. I'm still keep thinking, you know, where will I send her to play? Because there's nothing to call a community club, which used to be there when I was growing up. So, you know, we need to also look at what we are doing to our green spaces and community in the process of growing as a urban culture.
Right. Wonderful. No, that's really a critical point of play. You know, we talk about play, but it doesn't have to be in social media only. Thank you. That's very helpful. So, Dr. Rizvi, I want to come to you. So, this idea of partnership. And so we, I think the three panelists who preceded you said, you know, whether it's parents, teachers, you know, if you are teaching digital literacy, which a number of people have advocated, again, it has to be done at the school institutional level, teachers, right? But parents have to know too, because they are dealing with the kids, right? So you have that partnership. What from a national perspective, how do you do that? I mean, how do you, given your policy role, right? Say adolescent policies you have, how do you build that partnership with institutions at state and local level? And also, I'm just curious whether about social media platforms. Should they be a part of this conversation? And if they are, how are they in India? You know, so.
Okay, I would say partnership is it's kind of a key, because we do partner a lot with not only other ministries, whether it is the Ministry of Education or Rural Development or Urban or Wash and Sanitation. That is there within the policy, but we are also within the government free to partner with other people who are working in the field of adolescent health, whether it is the UN partners, the WHO, or the national level NGOs or even local NGOs, or I would say a lot of academic institutions. So that I think looking after adolescent health has that, I would say that niche thing that you can partner with a lot of academics and research people, because times are changing, especially post-COVID. A lot of things have changed for these young people. So then that flexibility is there with the government, that we can partner with research institutions, teaching institutions, private players also, to get them on board, to get their inputs as well. However, with the caveat that inputs are taken, but then how they translate into policy is a different game. We do take inputs and we have wonderful inputs. We create a lot of policies, inputs come, but when it comes to implementation, a lot of times we face a lot of hiccups, because a lot of our, especially health, is a state subject. So implementation is at the state level. We may create the best of policies, but if there is lack of ownership at the state, there is lack of funds at the state, lack of training, lack of awareness. So these small things, if the ownership is not there with the state governments, implementation becomes a big issue. Even we have 100% ownership of young people, that okay, their health is important, mental health is important. If it doesn't get translated into action at the state, we best of policies, but if implementation fails, we as a community, we're not doing real. So advocacy becomes a very strong point for us as policymakers, for young people to advocate, not just to other ministries, but to state governments also, to UT governments, to the partners who are funding programs across India. I will not name the partners. A lot of investment goes into maternal child health. I mean, maybe I'm being a bit mean, but a lot of investment goes into mother and child, and adolescents are often forgotten because they are kind of healthy. So that advocacy is something which needs a lot of strengthening, because if, like I mentioned earlier, if we don't invest now, we're losing out on a whole generation which is not really supported when they venture out into the skills which they're supposed to have to use safely as they grow older.
Great. Thank you so much. And it's nice to end on that note, actually. Believe it or not, we are actually a couple of minutes over the allotted time. We can speak for the next 4 hours on this topic. And still not be done with it. And I really appreciate the insights you provided. Essentially, there are some tools that can be used, that social media are both having a negative effect as well as a positive effect. But parental mediation at the family level is critical, and at the population level, I think, building capacity among institutions, certainly among teachers, and digital literacy could potentially be very helpful. And as a policymaker's perspective, again, you can't do everything. You have to really work at the state level and local level through advocacy and implementation. And we just, as a proverbial tip of the iceberg, is what we have covered today. I want to thank each and every one of you, Dr. Malik, Dr. Chhabria, Ms. Bhutia, Dr. Rizvi, for making the time. Really appreciate it. I know this is evening in India, for taking the time to talk to us. We hope we can come back to you for another conversation, given the importance of this topic. I also want to thank the audience, the participants. A number of you have joined us. I'm sorry we couldn't get to all your questions and comments, but we continue to work on this in this area. This is such an important area for us. The Harvard Chan India Research Center and Project Sanchar will continue to do more programs around this topic. I would be remiss if I don't thank my wonderful team who have been working so hard for the last few weeks in organizing this webinar. So let me thank them. Khushbu Agarwal, Dr. Ramya Pinamaneni, and Anubha Tyagi for helping us with this. So thank you, everyone. Thanks for joining us. And this will be recorded and posted on our Harvard Chan India Research Center website, as we do with all our webinars. So hopefully you'll be able to go back and watch it again. Thanks so much.